guys.
Hi.
Hello.
So we're going to talk about ethics today in OT, and also pull on some of the stuff that you guys have been working on for a while. You don't even need to write anything down yet. You can just stop and we're going to think. And who actually watched the video I assigned you for last week about Brittany Maynard and the death with dignity? Good. So, sad story, right?
Mm.
But a lot of thought and a lot of things to think about and really thought-provoking. And it's going to tie into some of the stuff we're going to do today. You also had the reading on the chapter about the Code of Ethics. And what we're going to do now is just, I want you to take out a paper and a pencil, and we're going to spend just about a minute, not really like a minute or two. Let me just write, like free writing, brainstorming, whatever comes to your mind, what you think about Brittany Maynard, about death with dignity, about the ethics, and what's right, what's wrong, the morals that play into it, and all that kind of stuff. So go ahead and do that, and then we'll start with everything else. All right, there's no right and wrong answers, so you can kind of wrap it up, and we'll add more to it later if you want to. Let's go ahead and talk about what we're going to do today. Some of the things I'd like you to see. You guys can see the slides?
Mm-hmm.
Yes.
So the objectives at the end of our lesson are that you're going to be able to apply basic ethical theories and approaches to ethical issues in healthcare. We're going to talk about some different ethical theories. Recognize the ethical issues that OT practitioners encounter in clinical practice. Then apply ethical decision-making guide for case analysis. Use the actual American OT Association Code of Ethics to apply to practice. And then also, at the end of it, be able to develop some effective communication strategies for some of the difficult conversations. So ethics are common shared values and principles used to promote and maintain high standards of behavior in real-life situations. There's ethics certainly in our work. We listen a lot about bioethics and healthcare ethics, but just in your everyday life too. Ethics is a practical discipline that provides rules or guidance for how one should act in consideration of others. So what I wanted you to do here, have you guys ever heard of the flipped classroom? I know you've complained to me a little bit about school, but you might not have known that was what it was called. So one of the things we're trying to do, and I think that by telling and explaining it to you, it can make it easier for you to understand and get more out of it. When the teacher assigns you something to do before class and you feel like you're doing the work before you've even learned it, has that ever happened? Who has that happened to? Where you had to do the work? You for sure said it. That's happened to you.
Yeah.
You say, oh, I didn't even cover this yet, and they made us learn it. And so they want you to do the work. And I initially, when I first heard about it years ago when you guys were complaining, thought that it was ridiculous that the teachers are getting paid to teach you, not for you to have to go home and learn it yourself. But there's actually a lot of research out there that says if you're doing some of this background work at home before you actually get to class, it gets your brain thinking. And I think especially with one of these topics like ethics, where it's kind of deep and there's a lot of feelings and a lot of stuff that goes on, if I throw it all at you here, we're not going to get as much of a discussion. If you take that video home and watch it first and read the chapter and think about the ethical theories and the Brittany Maynard video, just as an example, you can process it all and think about it. And then when you come here, I can hopefully facilitate some discussion with you guys. And we can talk about it as a group, and you guys can talk about it with each other and get more out of it. And so hopefully learn more than just me standing up here talking to you for the whole time.
That makes sense.
Good? All right, so ethics is actually a branch of philosophy involving systemic study and reflection on morality. So you have to think about your morals when this comes into play. Morality is actually shared beliefs really of a whole society. So different societies or different cultures might have different morals about what's right and what's wrong, conduct in society that sets the stage for that ethical behavior. Can you guys think of any examples of, let's picture our own culture and our own society and the typical morals. And can you think of another culture that has something that stands out to you as different kinds of morals?
Like those countries in Asia where they eat dogs. Here, dogs are our pets and our friends. In those countries, it's just like, oh yeah, dog for dinner. All right.
It's a very good example. They might be starving too. Anything else?
Well, how like it's seen as like commonplace and expected of people to like berate women and have gender inequality in other countries, while say in our country, like it's considered like taboo to have complete inequality like they do, and like consider them almost as property.
Absolutely. I think that's probably one of the easiest examples to think of is all the gender inequality things in different cultures, and people just treat women completely differently in other cultures. Moral reasoning is reflecting on ethical issues. Ethics provides the mechanism for this process. So ultimately, moral reasoning results in a course of action. You have their morals, and you're thinking about an issue, and you use this specific reasoning process in your head called moral reasoning. And then there's laws. Things can be illegal, but not unethical, or they could be unethical and not illegal. And we'll talk about that a little bit more with our example. So common ethical issues for OT practice include confidentiality, disclosure, so you want to keep your patient's information confidential, quality of life issues, the client's ability to make decisions, personal and professional boundaries, the use of power, how will resources be allocated for treatment, different cultural, religious, and family considerations, and then balancing the benefits and harm in the care of patients. So virtues, healthcare professionals, all of us, so doctors, nurses, therapists, all those kinds of people, are expected to uphold certain virtues. And some of those are integrity, benevolence, competence, kindness, trustworthiness, fairness, conscientiousness, caring, and compassion. And some of those make sense. If you go to the doctor and the doctor's telling you that something's wrong with you and you're very upset about it, then you're hoping that the doctor is trustworthy or that they have your best interest at heart, which is part of benevolence. And also that they're competent and they know what they're doing. So you need all of these things in your healthcare professionals because you're going to have to make some important decisions if you're the patient. So thinking about a clinical problem versus legal versus ethical. So a clinical problem is when there's something, a real diagnosis related to it, like multiple sclerosis or a broken bone in your arm or autism. Those are all clinical diagnoses, okay? Ethical things are choices that have to be made in and around the decisions in healthcare. And legal is related to ethics, but it's not exactly the same. So an example, you guys know what ALS is, right? We had that ALS ice bucket challenge a couple years ago. People lose all their function gradually and slowly, usually physical function first. So we're talking about feeding for a client with end-stage ALS. They're right at the end. And the client is having trouble swallowing and starting to choke on things. So the question, can the client eat or swallow safely? Well, that's a clinical problem. Can they do it or can they not? Do they have the muscles around their throat and their mouth to be able to swallow without choking? An ethical decision is, should the client eat if they have difficulty swallowing? And there's a lot of questions for that. So you're going to tell them that they can't eat anymore. Maybe they've only got a couple more months to live and they really like something and they want to have that to eat or drink. They want a vanilla milkshake. And you tell them, no, you can't have that because you might choke. And they're thinking, well, what difference does it make if I choke? Because I'm going to die in 2 months anyway if I get sick and get pneumonia. And then there's the legal part, which is, does the client have the right to refuse medical advice and eat or drink in spite of the clinical recommendation? So those are kind of two different questions, or three different questions, really. So can they eat or swallow safely is purely clinical.
Yes or no?
Yep. Should the client eat if they have difficulty swallowing? Well, that's their choice. Well, that's part of it. You know, should you have to listen to the doctor or the therapist, or can you make your own choices?
Should you intervene?
Right. And does the client have the right to refuse medical advice in spite of clinical recommendations? So what are their actual legal rights? And that depends on the situation. Let's skip ahead a little bit here. Okay, so in the OT Code of Ethics, there's an individual right to self-determination. Okay, people get to make their own choices. So it's autonomy is one's ability to act independently on one's decision for one's own well-being. So they get to make their own choice. And if you think about Brittany Maynard, what was her whole thing?
She wants to be able to get the choice of when she's going to pass.
Right, and autonomy was what she talked about a lot. And her mom would say she's an autonomous person. I mean, she likes to make her own choices and decide for herself.
She chooses what her own path.
Yep, and that's what this cartoon says, right to choose. And the doctor's saying, but what about our right to choose what you do? And so who gets to make the decisions?
Yeah.
That's autonomy in healthcare. So in healthcare, it's presenting the clinical situation, advising the options and the expected outcomes and the risks, but then who gets to make the decision?
The patient in the end.
Right, and their family together, or whoever they want to help them make the decision. So there can be autonomy conflicts, and it also comes into that privacy and confidentiality. Non-maleficence, there's a big word for us, do no harm. Okay, that's back to the Hippocratic Oath. I know you guys know about that from Greece and all the Greek mythology stuff.
Mm-hmm.
Well, it's not mythology, it's Greek history. But Hippocrates was that first doctor, and his big thing was do no harm. And I've said that to a lot of people that I supervise and work with too. You might not always be able to help somebody and fix them, but the first rule you have to make sure is you're not going to make them any worse, and do no harm. Now, there's some things you think about, and you guys have heard me talk about this, temporary pain and discomfort from pain or tests, treatment, but it's balanced with the intended therapeutic benefit. So when you have to get a shot, right?
You know,
It's to-
like after
it's
knee
to help-
surgery where
it's to-
it's like hurts for the first, like the days after when you get like surgery, but then it actually works when you're done.
Exactly. So you might have to give somebody a little bit of pain, but if it's worth it in the end for what the end result's going to be, you don't want to make them long-term worse. But I have to do that at work all the time. I stretch people and it hurts when I'm doing it, but it's so that they'll regain function and be able to use their hand long-term. Okay? Make sense?
Yeah.
Much?
You're at 9:30 now, and with the other minute and change, it's
All right, and then there's beneficence. And so it's doing good for one another. You want to make sure that you're competent and that you know what you're doing the right things for people. It's protecting and defending the rights of others, removing conditions that will cause harm to others. Recipients of healthcare services expect that providers will work for their benefit and provide the best care possible. So patients expect when they come in that you're going to do the best you can do. Make sense?
Mm-hmm.
Let's run through the other ones quick. Justice is being fair and equal and distributing care fairly. All right, veracity is being truthful and honest. And fidelity is being faithful and loyal. It has a lot to do with the places that you work. So obligations of loyalty and keeping promises and commitments, maintaining good faith relationships between the service providers and the recipients. All right. So let's go back and think about that Brittany Maynard video again. And which ones of these things do you think apply to that? What were her doctors thinking when they give her medicine that she could kill herself with?
I mean, they were probably thinking that it was going to give her the least amount of pain, so
That's true,
it's doing less harm.
but it's doing harm. Because they didn't give her the cancer.
She's going to die anyway.
But it's
though.
indirect harm. Like she's making it. They're giving her the option to make the choice herself. They're not actually making the choice for her.
Right, so that her giving the choice herself is autonomy, right?
Yes.
Okay. But what is them giving her medication that could kill her? Where does that come into with the do no harm rule? They are doing her harm by giving her that medicine.
It doesn't.
But they're also
It
saving her
doesn't.
from
It
other
doesn't.
harm.
It doesn't come in. It doesn't contact it at all. I think because of the fact that she's already going to die. It's not the fact. It's not like you're going to save her from death by giving her that. By not giving her that medicine.
But is the doctor right to be able to speed that process up?
I think he's perfectly. I
Yeah,
think he's perfectly in the right to allow.
I agree.
What do you think of people who think that that's wrong? Like people who maybe are very religious and think that only God can make that choice, that the doctor doesn't get to make that choice, or the patient for that matter.
Well, I feel like they're not always right, for example. Because I mean, like,
They can believe what they want to believe.
They can. And so what does she believe?
well, she
I
believed
believe
that
that it's her
she believed
choice.
that she had the right to make that.
And do you guys
choice.
know why she had to move to Oregon?
Yeah, because they
Because
didn't have
it
a law in
wasn't allowed by
California.
law,
Right.
and that's where the legal aspect of it comes in.
Right. So she had to go somewhere where it was legal for the doctors to do that. And she had to find a doctor that believed it was a good idea, because some doctors would have never given her that medicine.
Yeah, 'cause some doctors feel
Just
That they're-
Hippocratic
that
oath
they-
above everything else. Do no harm. No
And
harm.
so that is what you call an ethical dilemma, when the doctor's sitting there going, I could give her this medicine and she can die with dignity at her own choice, or I could recommend more chemotherapy or other kinds of treatment that might extend her life another month or two, but she won't be dying yet. And what do? That's where it comes into some of those ethical, what we call ethical dilemmas. Logical?
Yeah, that makes sense.
Yeah.